$147, getting faster.
So in class today, my teacher kept talking about how it's a safe place. I was like, duh, of course it's a safe place. You have fire alarms and sprinklers everywhere.
Right. Okay.
Yeah, stupid, I know.
Yeah.
Hey, have you ever wondered what the most common pitching injury is?
No, not really.
Well, if you had to guess, would you say it's A, elbow injuries, B, wrist injuries, C, shoulder injuries, or D, back injuries?
C?
Yeah, good job. I bet you're wondering how I know all this.
Not really, but how do you know all this?
Well, I happen to have a PhD in sports medicine.
Really? I'm a registered physiotherapist.
Cool. Oh no! We need a doctor. What happened? Are you okay?
It hurts so bad. It's burning.
Are you crying?
No, I'm not crying. Where's my doctor? It hurts so bad.
Somebody call for a doctor?
No, I'm just lying on the grass because I love the feeling of damp grass on my skin.
Yes, we called for a doctor. We saw him throwing a few pitches and then he fell to the ground in pain after throwing one.
Okay, doctor's here. What happened?
Well, I was just throwing that fast heat and it just gave out on me. It just hurts so bad.
Just as I suspected. Partial thickness rotator cuff tear. Supraspinatus.
What the heck does that mean?
Well, the rotator cuff is the name given to a group of muscles and tendons that act to stabilize the shoulder. The muscles include the supraspinatus, infraspinatus, teres minor, and subscapularis.
Sounds like you're speaking Spanish. Just give it to me straight, Doc. How long do I got?
Well, you got 40 to 60 years tops. But as for your shoulder, we need to start talking about some sort of treatment.
Treatment? What kind of treatment?
Well, there are two different types of treatments: operative treatment and non-operative treatment. Operative treatment involves surgical intervention to repair the affected area. Non-operative treatment includes other methods like physical therapy.
So, unfortunately, there's no current consensus on single treatment approach to partial thickness rotator cuff tear, since there's lack of literature. But based on evidence, we can help you to make a quality decision.
Okay, can someone please explain them to me?
Non-operative treatment consists of several steps: conservative management, physical therapy, and advanced physical therapy.
Conservative management involves the stopping of anything throwing activities, consumption of non-steroidal anti-inflammatory to reduce pain, eyes, ultrasound, and electrical stimulation.
Next, physical therapy focuses on restoring motion and maintaining normal shoulder dynamics to restore internal rotation. Strengthening of the shoulder musculature is also performed.
And last, advanced physical therapy is carried out once pain decreases and range of motion improves. The patient is prescribed exercises focusing on the rotator cuff, trunk, and core strengthening. In overhead athletes, particular attention is paid to the kinetic chain and the institution of an interval throwing program.
Subacromial corticosteroid injection can also be administered for acute pain relief, allowing for more aggressive physical therapy. However, there is a lack of high-quality evidence evaluating its efficacy.
It's important to know that non-surgical treatments may not lead to improvement until 6 months and may only last until 18 months. Patients consider operative treatments if they are not satisfied with outcome of non-operative treatments.
That's it? You might as well leave me here to die. Is there anything else?
Well, there's also surgical treatments.
Surgical? You mean like knives and stuff? Are you f***ing insane?
It's not as bad as it sounds. Plus, some of the surgical treatments have produced good results.
Surgical treatment is based on the magnitude of your current symptoms, size of the tear, location, and quality of the rotator cuff tissue remaining. If the tear is less than 3 millimeters deep or 3 to 6 millimeters deep, it is considered a grade 1 and grade 2 tear, respectively. If the tear is greater than 6 millimeters, it is a grade 3 tear.
It's important to know that all operative treatments included rehabilitation for 6 months post-surgery, with an initial protective phase followed by a gradual return to range of motion and finally a gradual return to competition.
Recent published evidence by Matthew and others produced good results with the debridement method of treatment on grade 1 and 2 tears, though not nearly as effective with grade 3 tears due to the extensive damage.
What in the world is debridement?
It's the medical removal of dead, damaged, or infected tissue to improve the healing potential of the remaining healthy tissue. They use a mechanical shaver to remove this tissue.
The majority of elite baseball pitchers who underwent debridement were able to return to competitive pitching, though not all were able to throw as fast or as accurate compared to prior injury.
The mean time of pitchers' return to throwing was 5.5 months post-operatively, and the mean number of seasons played after surgery was 2 years.
Well, that doesn't sound so bad. Is that the only one?
There's also something called arthroscopy. This is a minimally invasive surgical procedure in which an instrument called an arthroscope is used. They use the arthroscope to complete the tear and then repair the entire tear. It involves the restoration of the anatomy of the injured rotator cuff muscle and tendon, and repairing of the delaminated components.
It's also considered an outpatient procedure where the patient is sent home the same day as the procedure. There is also a less soft tissue dissections, a smaller incisions. Patients reported a significant reduction in pain and were very satisfied with the surgery.
Recent literature about Deutsch shows there were no complications involved during the procedures among patients. All patients improved range of motion and strength with little difference between operative arm and asymptomatic arm in isometric strength measurements.
Okay, let's just do it. Let's do it.
Well, this literature concluded that this procedure may not be ideal for overhead throwing athletes because of some impingement that occurs on the margin of the glenoid. In addition, it may constrain the shoulder.
More recent evidence presented by Brockmeyer and others show that a modified form of arthroscopy has produced good initial results. They use a suturing technique called mattress suturing that spreads the tension along the tear.
They maintain that this technique offers a superior result and an improved likelihood of return to competition. Initiated throwing begins 4 to 5 months post-operative and competitive throwing at 7 to 12 months post-operative.
This evidence has shown to be more beneficial for grade 3 tears, but more follow-up time is needed for a more definitive assessment of success of this technique.
So let me get this straight. Non-operative forms of treatment may only start working after 6 months and only last until 18 months?
Yep.
And surgical treatments like debridement and arthroscopy show significant reductions in pain and return to throwing between 4 and 5 months?
Yep.
And return to competition is between 7 and 12 months for arthroscopy, but 2 years for debridement?
Yep.
And debridement has been shown to be more successful with grade 1 or 2 tears.
Yep.
And arthroscopy shows to be more successful with grade 3 tears?
Yep.
Okay, that settles it. The treatment I'm gonna go with is...
We're just friends, what are you saying? Said there's another, look right in my eyes. My first love broke my heart for the first time, and I was like, baby, baby.
Hey, I thought you were injured.
I was just making it. Hey, you guys wanna get some ice cream?
Yeah.
Yeah.